Hey, it's Dr. Conley. I'm going to take this opportunity to talk a little bit about boundaries. Boundaries is an ethical issue. Clients will ask us questions. They will ask you everything from the very embarrassing, have you ever had to pee in a cup in front of somebody and have them watch you? They'll ask you that. They may ask if you have been married, if you have had kids. Did you ever go through childbirth? Were you ever divorced? Are you an alcoholic? Was anybody in your family ever addicted? Did anybody ever hit you? Uh, did you ever have a gay experience? I mean, you got to be ready. They come out of left field sometimes. And other times, they're pushing the boundaries. And I think what the clients are doing is trying to level the relationship. So we have a lot of power over our clients, and they want to know that we know what it feels like to be in their position of power, which is relatively powerless. I mean, people are intruding into their life. Uh, in the case of Josie, they're privy to what's going on in her relationship with Frank, every gory little detail, and he's manipulating her. And, she does feel humiliated. And her way of trying to level that, I think, is by asking the counselor questions. The other thing, maybe some clients may want to use that as a defense against having to talk about themselves. What they're undergoing is so embarrassing and so difficult for them to talk about that if they can divert the conversation over to you and get you talking about anything from your own experience, maybe as a client, to the latest sports news, like, hey, how about that Super Bowl? To keep from having to talk about the difficult things with themselves, address that with them. Address and say, you could say to the client, I know you're asking me this, and I understand it. Absolutely. I don't discuss, my own personal experiences with clients because we're really here to work with you. You could reframe it and say, hey, look, I know this is humiliating and embarrassing for you. You want to know if I understand? I get it. I understand. I don't have to have been there to get it. And I'm not saying whether I have or I haven't, but I understand. This is a very difficult position for you to be in. In the case of Josie, she goes on and tells us about her experience with Frank being very manipulative. I mean, she really was open. She opened up a boundary wide open into, what's going on in her home. That doesn't mean that we're expected to do the same. We don't have to tell clients if we're in recovery. We don't have to discuss any aspect of our personal medical history, whether we've ever had an STD or a UTI or anything else that they're going through. Were you ever hit by a car? It's like, well, we're not talking about what's happened to me. We're talking about what's happening to you and what we can do about it and how you can respond to it the best that you can. By the way, with observed urinalysis for clients, that's definitely a drug court thing. It's a probation court thing. It is I think I mentioned in somebody's post, it is a very powerful reinforcer when that is taken away. It's called negative reinforcement. We reinforce good behavior by taking away something that's very uncomfortable. And so it's negative, net negative of something's being taken away, but you get it. It's the old behaviorism stuff. And that's very powerful. Clients will do anything to get off of being required to participate in that. So we can use that. There's a lot of, and that's the whole point with treatment courts is sanctions and rewards. One of the rewards is give me 12 negative UAs and then you won't have to take another one for a month. Well, that's very powerful. So every little bit helps. And learning to negotiate rules, and boundaries, especially the boundaries with clients, is a very important step in developing professional counseling skills and relationships.